Hello and welcome to yet another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. My name is Mary Joseph and I am your host. Please do well to follow us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. The intake of drugs without prescription from a doctor is the simplest way to define self-medication. This method has generated a serious public health concern, especially with regards to the treatment of malaria, not only in Nigeria but across Africa. The medicines taken are often referred to as over-the-counter or non-prescription, as in Nigeria, these drugs can be sold by persons on the roadsides, at pharmacies, supermarkets and other outlets. Although there are a number of factors responsible for self-medication in terms of cost of clinical consultations to ignorance or personal insecurities, it's important to consider the potential side effects of such uninformed actions, as these practices can lead to drug addiction, allergy, worsening of ailments leading to drug resistance, and there are also tendencies of incorrect diagnosis or dosage, and this could also lead a person to disability and premature death. Well, on today's episode of Wellbeing, we will be taking a look at some of the problems associated with self-medication and the treatment of malaria. I have a guest who would highlight some of the issues bordering around self-diagnosis to leave you better informed of the dangers it poses to your health. But before then, let us quickly take this short break. We'll be right back.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you could visit our website at spectrumtv.ng to be a part of the family. Today on the show, we will be looking at the dangers associated with self-medication with regards to the treatment of malaria, as my guest, who is the Malaria Case Management Officer at the Akwa State Ministry of Health, and she will be addressing some of the issues bordering this.
My name is Mrs. Mfon Jonah. I work as a Malaria Case Management Officer for the state and also the Malaria Vector Control Research Officer in the Ministry of Health. The reason for the practices, that is, those kind of practices is, for me here, I'm going to say that we talk about the socio-economic status of that individual. We talk about ignorance, ignorance in the aspect of the patient who does not know where to go rightly once he or she is sick, and ignorant to the fact that some signs and symptoms of malaria are almost like those of other diseases, you know, like fever. When someone has fever, fever is just an indicator telling us that something has gone wrong within the system, or there must have been a foreign body that has successfully, entered into the system of that individual, thereby altering the settings of the biochemistry of that individual. Then the person will start presenting with some fever, aches, pains, and when it is like that, if the individual does not know that he or she has to seek medical aid immediately, they go about moving from one chemist shop to the next, to the pharmacy and all that, instead of them to know that to go straight to the nearby health facility for appropriate diagnosis, follow-up and treatment. They rather would want to go to the chemist shop to give themselves their own self-medication, and probably because they have seen it in their neighborhood, some other person must have been treated of malaria, maybe using one of the anti-malarial commodities. From there, that person got well, and so since they are living quite close, they have this person now develop the same signs and symptoms. You go back to that person, they will just write the drug to them to go and buy, instead of coming to the facility, to health facility, approved health facilities for those healthcare providers to provide a functional health services to them. They rather would want to just use the prescribed drug that was maybe given to some other person who had spent time to go to the hospital to have his or herself diagnosed of malaria, and the actual drug was given, and when he took that drug, that individual became well. So they decide to go buy that same drug, thinking it's the same disease condition. By doing so, the dangers in that is much, because it's going to actually affect the individual adversely, in that person, instead of going to the hospital immediately to do the needful and take the appropriate treatment, they go about beating about the bush. Before they get to having the treatment, the condition must have gone worse, maybe developing from uncomplicated malaria, which would have been manageable at the OPD, and then into severe malaria, which will now have need for that individual to come to the hospital and be admitted for admission and treatment. And by that time, things must have gone wrong also within the system, because he or she must have been taking some drugs, not minding whether the drug is for malaria, and not also knowing whether the sickness or the fever, the problem is he or she is having, is malaria. They need to actually go to the hospital and then find out, carry out some investigation like the laboratory test to actually diagnose or rule out other disease conditions. Once an individual has fever, that people may say that malaria is the cause of fever, but malaria is not the only disease that comes up with fever. All other diseases that are caused by other microorganisms, we have them many. We have the bacteria, we also have parasites, we have fungi. Any of these organisms, once they gain an entry into the system, it triggers on the fever because of its activity within the system. When talking about malaria here in Akwa Ibom State and in the whole country, I know that the new malaria protocol is that we must do the testing before we carry out any consultation on anybody that has fever, to rule out other disease condition, and to also be sure that the fever that individual has is as a result of malaria. We must carry out the test. Either we test that person using MRDT, that is Malaria Rapid Diagnostic Kit, which takes us within 20 minutes you have the test result, or we go with the microscopy. Microscopy is a gold standard for malaria testing, but two of them also work very well. They are all together, they are very potent and quality assured. And so we better always tell our people to go out for actual testing for malaria, to know that it is malaria before you start taking any drug. And when it is malaria, please, the drug must be given to you by a trained healthcare provider, not just taking the drugs anyhow, because in taking the drugs, you may buy the drug, but you may not know how to administer it, and it goes down to causing a lot of problems that you may not be able to come out of. The potential implication of self-medications, they are much. We can say that if someone does not go out for diagnosis before treating oneself of malaria, you end up taking incessant drugs. All the drugs that they may want to give to you, just to make sure either the fever goes down, the pains goes down, but the actual causative organism is not dealt with. That will go a long way to destroying that individual's cells in the system of that individual, depleting the cells and also causing some form of toxic to the tissues and cells of that individual. So it is very, very important, and is a key thing to do to make sure that we always test and be sure that we have malaria before the malaria anti-malarial commodity or anti-malarial drugs are administered to us. We can't just do without those people from our different communities, because they have always been there and there's nothing you can do. So rather what we do is to also engage them. We had integrated them some time ago in the training and in creating the awareness, teaching them on how to approach malaria treatment. So for the community pharmacies, they know the do's and don'ts, and most of them are aware of the current guidelines in malaria treatment, that they need to test before they even prescribe and give out any anti-malarial drugs, because they know that incessant taking of the drugs may go down to depleting our cells, giving us other disease conditions that we wouldn't have developed, and then coming out as poisons. The drugs may be poisonous to the cells, because the drug that you give to them at that time, if it is not properly diagnosed that it is malaria, you keep on pumping this individual with anti-malarial drugs. Where will it have to act? It has no place to act on. And so gradual accumulation of those drugs in the system of that individual becomes toxic to the system. So it is not good to take these drugs without, or any drug, without going for proper diagnosis to know that you are actually having malaria or any disease before you take the drug. That is why I said that at the pharmacy shop, they will always tell you, take the drug. You go there, you buy your anti-malarial drug, maybe Amatem or any one of your choice that you want to. They always tell you at the counter, they take one morning and evening, or sometimes 4 morning and evening. They will not know the implication of that. See, in the medical field, we were all trained on rules in the administration of drugs, and I wouldn't fail to always mention that, because this thing is key in the management of any disease condition. Because once you give somebody drug, you need to take time into consideration. The timing of the drug that you are giving to that person matters. So we give these anti-malarial drugs if it's an uncomplicated malaria. Then we administer ACT drug orally. We give them these drugs 8 hours after. That is, we start as a 0 hour. The starting dose is known as 0 hour dose you give, and then after 8 hours from there, you administer the next dose. Why we do this is because we want the remnants of the previous drug which you had given to still remain there in the plasma, protein in the body of that individual, so that when the next one that we give by 8 hours, in 8 hours time, the next dose that you are giving will continue to act. It will now the former one there will take up the current one, and they act together, so the condition will facilitate its clearance. Our people here, not only here in Akwa Ibom State, I know that we Nigerians, we were born into a particular community, we were born into a particular tradition and culture. So our people are not also left out. Some of them may want to even say, I wouldn't have this money. So the money going to the hospital, where will I have? When you go there, they will tell you, run tests, you pay money, buy card, you pay money, this and that. But they are ignorant of the fact that that money, the little money they will pick the card, maybe 200 naira, and then run the test, will do them more good than the more expenditure which they would have incurred when they allow the condition to become severe, and when it is now becoming complicated. Yes, so many of the families who want to get to using the traditional method of trying to see if they can clear off the malarial symptoms with that, trying to save the little money they have because of how the economy is. They consider if they have this little money, we now take maybe 1,000 or 2,000 naira to the hospital for this thing that we know that if you take an enema, it may clear. So we can now use the 2,000 to pick food for the children. They don't know that by so doing, they are even causing some form of complications in the future, because the 2,000 that you would have used to get to the hospital, get yourself tested, and then get some drugs really prescribed for you by a trained clinician or a trained healthcare provider, you find out that you continue to pump in that the traditional things into the system. It becomes toxic to the system, and before you will come to the hospital to realize that you have caused some problems to your tissues and cells, it's going to take much money than the little one that you would have used if you had come early. So that is why it is very key for any household to always seek medical aid early as possible. Once you have a deviation from normal health, like when somebody is having fever, headache, pains and all that, loss of appetite, maybe person vomiting and all that, you need to actualize what is the problem in order to know the kind of drug that you give, than just treating or asking them to go take enema. Like if it's here in this Akwa Ibom state, go take enema, go take purge, this and that. So, all these things. So when our people are, when we are now, because of economic status of the individual, they may want to think that going that way is better, but not knowing that that is even they are incurring some worse situations to the family by doing so. So some families do prioritize, embracing the traditional herbs than coming to the hospital, owing to their economic status. Okay. The government has done a lot in this part of the country. As I'm speaking to you, Akwa Ibom State is one of the states that donor partners are actually working very hard, unrelenting their efforts on daily basis. As long as malaria is concerned in this place, I know that I have some partners who are collaborating with us to make sure we take malaria to a certain level, at least near elimination level in the state. We have the government in this state has made it possible. It has created an enabling environment for the partners to come down, settle, feel good, and then come in to join hands with us to make sure that our people here remain in at most and optimal health. In the aspect of malaria, in the state here, malaria treatment to the vulnerable groups are free. And the state government has also made sure that we don't lack the preventive and prophylactic drugs for the pregnant mothers. As I'm speaking to you, for some months now, like 2 months now, we were short of SP, sulfur-doxine pyrimethamine. That is, I'm talking about our Fancida and all these, the 3-tablet drugs we used to use in those days for the treatment of malaria. They are no longer now used for treatment, but they are used for prevention of malaria in pregnancy. And so because of that, for some time now, it's been the SPs has been out of stock in country. But I want to tell you that this state is able to procure SP for our pregnant mothers. As I'm speaking, maybe it's ongoing, the distribution is ongoing to the different health facilities in the state. So the government has done a lot in that. And another thing is we are soon going to have our net campaign before the year is out. So everything has been put in place by the government of this state. So we are prepared. So another thing is that the government has also used the staff that we have in this SMEP and in the ministry to collaborate with partners like the Breakthrough Action and the President's Malaria Initiative, which are actually implementing their projects through the MSH in this state. in making sure that we create more awareness, more sensitization to people, both at the localities, so that they can come out en masse to always embrace the healthcare facilities that have been cited for them in their different domains, so they can make use of those facilities. Instead of allowing people to die of malaria, they can go there, get malaria services free, and these drugs are all free. It's been given to us from the USAID, the donor agency. For the past 5 years, the state has been receiving anti-malaria commodities free in this state. So we have free testing. So yes, no, the test is free. For malaria test is free. Malaria test is free. Malaria drugs are also free. Yes. All I will want to advise our people is that I want to advise my listeners out there that they seek early medical aid at any time they have any deviation from their normal health, like fever, headache, pains, aches, and all that. They should seek medical aid as early as possible to avert the problem of self-medication. In the course of they are going to search for what is their problem, they go taking drugs at the chemist shop at the counter, and then they take it. There they will always tell them take morning and evening. They won't tell them the timing that they should take these drugs, which goes a long way to make this drug effective, and also for one to have a positive result from the anti-malaria commodities that we have in the state.
It is surprising that many people see no problem with self-medication when it comes to the treatment of malaria, but the question remains, why would people engage in self-medication despite being aware of the danger it poses to our health? Well, I'm sure you enjoyed the conversation highlighted by Mrs. Mfon Jonah today, and I'm sure you've learnt one or two from it. Well, you should desist from it and also follow the right procedures, as your health is important to us. Thank you so much for being a part of the show. Remember that you can also be a part of the family by following us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng to be a part of the family. Join us next week for yet another amazing edition of Wellbeing. My name is Mary Joseph. Do enjoy the rest of your day.